Hello everyone, this is Dr. Naz. Welcome to my YouTube channel. Today I'm going to discuss about amoebiasis, which is caused by Entabmoeba histolytica, and its liver manifestation, which is amoebic liver abscess. Entabmoeba histolytica exists in two forms: a motile trophozoite or as a cyst. Cysts are transmitted by the ingestion of contaminated food and water. Trophozoites emerge from the cyst in the small intestine and then pass on to the colon, where they multiply and causes intestinal amoebiasis. Their invasion in intestine will result in amoebic dysentery, which is called bloody diarrhea, and tenesmus and abdominal pain will also be there. It can be with or without liver abscess. The systemic symptoms may include headache, nausea, anorexia. So diagnosis can be made from fresh stool sample, which will show mobile trophozoites containing red blood cells, and the presence of amoebic cyst alone does not imply disease. In sigmoidoscopy, there will be typical flask-shaped ulcers. Amoebic fluorescent antibody test is positive in 90% of the patients with liver abscess and 60 to 70% of the patients with active colitis. These are the flask-shaped ulcer with broad base and narrow apex. For treatment, metronidazole and diloxanide furoate is given. Metronidazole 800 mg 3 times a day for 5 days, and diloxanide furoate is given orally for 10 days. It is a luminal amoebicide and given to clear the bowel from parasites. Amoebic liver abscess is the most common extraintestinal manifestation of amoebiasis. It occurs when trophozoite enters the portal venous system by burrowing through the large bowel mucosa. This is a radiograph, and it shows there is a circular pyogenic abscess in the liver. The patient may present with right upper quadrant abdominal pain, which may radiate to right shoulder. There will be tender hepatomegaly. In contrast to pyogenic liver abscess, there is absence of toxicity. That is, there will be no signs of fever and sepsis, etc. There will be no high swinging fever. Single abscess is present, most commonly affecting the right lobe. There is no primary lung Entabmoeba histolytica infection. It always occurs as a complication of liver abscess by Entabmoeba histolytica. So what happens is, when the abscess in the liver ruptures, it crosses the diaphragm and enters into the lung or pleural cavity and causes infection over there. The rupture into the peritoneal cavity and pericardial cavity is less common. On complete blood count, there will be neutrophil leukocytosis. Ultrasound abdomen can visualize liver abscess. There will be detectable antibodies in 95% of the patients. For the treatment, metronidazole and diloxanide furoate is given. Surgical drainage is required when there is failure to respond to the medical therapy and when there are complications, that is, involvement of lung and pericardial or peritoneal cavities. By the drainage, you will obtain a chocolate colored anchovy sauce like cyst, which is the specific for amoebiasis. So that's the end of the lecture. If you learned something from it, please do like the video and subscribe to my YouTube channel so that I get motivation to make further videos. Thank you so much for watching.